Right guys, welcome back. So first update video on this new channel. In this one I just want to talk briefly about how it feels to be given a diagnosis like this, how it affects the family and your life in general, and I also want to discuss the treatment a little bit. Right off the bat I want to apologise because these videos aren't scripted, they're not edited. What you see is what you get, they're just raw. Don't really know exactly what I'm going to be talking about, so apologies if I ramble on or repeat myself. So I'll start with the diagnosis. Now some of this doesn't make any sense to me, so it's probably not going to make any sense to a lot of you guys. The diagnosis was T1B, N2, N1C, small cell lung cancer with multiple brain metastases. It's saying 40 plus brain metastases, which doesn't sound good at all. So the cancer obviously started on her lung and worked its way into the brain, and it's an aggressive form of cancer, hence why she's been given a life expectancy of a year, maybe two, with treatment. So how does it affect you when you first receive a diagnosis like this? Well, obviously the whole family is devastated, at a loss for words. This is like the worst news that any family could possibly get. It's funny how your mind works, because as soon as they mention the word cancer and 1, maybe 2 years to live with treatment, it's almost like they're going to die instantly, because your whole world just comes crashing down, and everything you know is changed in an instant. So when we was in the room and the doctor gave us the bad news, all I can remember is jumping out my seat and kind of putting my head in my hands, and at that precise moment I just wanted to rage like I've never wanted to rage before. Obviously I didn't do that. I didn't believe what I was hearing. I think I'd kind of told myself it was going to be fine and she could get treatment. So to be given news like that, my whole world just stopped. And then for the next few days, there was lots of tears shed. Everyone in the family is just absolutely devastated. We didn't feel like doing anything. It was almost like everything else in your life that you do on a daily basis just seemed so inferior to the gravity of the situation. What I mean by that is, obviously there's things we do in our daily lives, like shopping, food and groceries, etc. Cleaning the house, DIY tasks that need doing in the house maybe. For me, there's the workshop and my main channel. And from the minute we were given a diagnosis, you just you lose the will to live almost. Everything just seems completely and utterly pointless. You just end up in this pit of despair, is the only way I can describe the feelings. So for probably the first week, we didn't do nothing. We didn't do any shopping. The house wasn't cleaned. I told myself that I wouldn't be coming in the workshop or making any future videos, and I was done with the workshop stuff because there just wasn't any point in doing anything. And I know for people on the outside looking in, that seems like completely the wrong way to think, and you'd be right in thinking that. But for the first week after receiving the news, like nothing else mattered. It was almost like everything we knew in our lives was changed, just like that, and was never going to be the same again. Now, obviously my wife's chosen to have treatment, which is a good thing, and fingers crossed maybe she get more than 2 years. We've heard plenty of positive stories from people with a similar type of cancer that were given 2 years. There was one particular comment on the update I posted on my main channel from a guy. Can't remember what your name is, so apologies for that, but you know who you are if you're watching this. His sister had been diagnosed with terminal cancer and was given 2 years. Well, 15 years down the line, she's still alive and living a normal life. So who knows what's around the corner. But rather than just kind of wallow in self-pity and do nothing, you need to get your mind in as good a place as humanly possible, rather than dwelling on the fact that someone that's really, really dear and close to you is going to lose their life to cancer. You need to kind of get your mind in the right mindset and concentrate on living every day like it's your last, making lots of happy memories and trying to keep things as normal as possible. I'm a strong believer that positivity does make a huge difference. I mean, if someone just gives up the will to live, then you might as well just die there and then, because there's no point in even carrying on with anything. So we're all kind of trying to be really positive, upbeat, making plans on different things we can do, places we can go with the family, just making happy memories. And even if she does have only a year left, we're going to try and make it the best, happiest year of her life, and try and help her to enjoy whatever time she has left. Now, there are going to be days when we're going to be upset or crying or whatever, and we've sat down, we've talked about it, and we've said that's okay. We're all going to have days where we're kind of just feeling like flat, feel like crying. But then we've got to kind of help each other to pick ourselves up and just keep living. I mean, no amount of moping around is going to change anything that's going on. It's a horrible situation to find yourself in. It breaks my heart every day, because I just don't want to imagine life without my wife. But in the time that she's got left, I'm determined that I'm going to help her to keep positive and make as many memories as we can. And hopefully, you never know, we can end up with a miracle and she could live for many years. And that's the way we're kind of trying to deal with it. So, obviously, she's chosen to have the treatment for as long as she can cope with it, unless she gets really bad, which, fingers crossed, doesn't happen for a while. So, because my wife's quite awkward when it comes to getting blood, because they always struggle to find her veins, so what they've decided to do is put in a PICC line, PICC line, which is inserted into your vein. It's actually named Peripherally Inserted Central Catheter, or PICC for short. And they basically put it in your arm just below your elbow, and that's where they will administer the chemotherapy via drip. That's where they can take blood from, and it just means they're not poking and prodding her every time she goes in for a blood test or for treatment. Now, having the PICC line inserted means there's a whole load of extra appointments that she's got to go to in order to maintain the PICC line, make sure it's working as it should, make sure it's flushed out and clean to prevent any infections, change the bandaging, etc, etc. But in the long run, it will make treatment a lot faster and easier. So she's going to be having 4 rounds of chemotherapy. Now, they consist of a 3-day course. On the first day, she attends the hospital, and she has, I think there's 4 different things they put in via the drip, and the whole procedure lasts for about 4 hours in order to get all the different treatments into her body. And then for the following 2 days, it's in the form of tablets. So she's got like steroid-based anti-sickness drugs, which she takes for the 2 days following the intravenous drip. And then there's some chemo drugs, which she takes for the 2 days after the intravenous drip. And then she's got some normal anti-sickness drugs, which she can continue to take to try and keep the sickness to a minimum. Now, some people suffer quite a lot after chemo with sickness, loss of appetite, losing weight. I mean, there's a whole list of side effects that are possible when you're having chemotherapy. So she's obviously had the PICC line inserted, and she's done her first 3 days of the chemo treatment. And if I'm honest, I think she's handled it really, really well. Really proud of her, how she's like coped with it. So she had the intravenous drip, and the following 2 days we were able to go for a walk around our local park, because obviously we want to try and get exercise and spend quality time together. It's not the longest walk, but it's a walk nevertheless. So I was actually amazed that she was able to do that. The 3rd day she was a bit low on energy. We did get over to the park, but we ended up buying a coffee and sitting on a bench and then coming home. 4th day, she spent most of her day in bed, feeling sick, couldn't really eat nothing. 5th day, she was not as sick. It kind of came and went as the day progressed, but she was able to kind of potter around the house and do things. Next day, better again. Still had a little bit of sickness, but overall feeling quite good. So, I mean, I'm really pleased with how positive she's been and how well she's actually coped with the first lot of chemo. Now, they do reckon that as the chemotherapy goes on, she will get more tired, maybe more sick. I mean, everyone handles treatment differently, and the doctor did say that going by some of the treatments that she's had in the past and how she's handled things, that they reckon she'd breeze through it fairly well, and certainly after the first round of chemo, she's actually handled that really well. So I see that as a positive. So she's had the first one. She's got 3 more of those, which are basically the same as the first. First day intravenous drip, and then 2 days of the chemo drugs and the steroid-based anti-sickness and the normal sickness tablets, which you can go on with. On top of that, she's also taking the anti-seizure medication still, and various other medications. After she's had another 3 sessions of the chemo, she then has 4 rounds of a follow-up drug, and what the follow-up drug does, I think that's going to be the same. It's an intravenous given by drip. But from what I can gather, don't quote me on this because I'm not a doctor, but when you're having chemo, it doesn't just destroy the cancer cells, it destroys all your white blood cells as well. Hence why you're at high risk of infection, especially in the current climate. So the second treatment, it kind of works on the cancer cells, but it also helps to replenish the white blood cells. I think it's the white blood cells, as the first round of chemo has killed everything off. So she has 4 rounds of that. Obviously, I'll tell you what that's based on, what that entails, as and when she has the treatment. I'm assuming it's going to be similar to the chemo. So at some point, I think it was after the 3rd round of the normal chemo, they're going to give her another scan, obviously to see how it's affected the cancer cells. Now, as far as I'm aware, this chemotherapy is only for a maximum of 2 years. I'm not sure if they're going to carry that on if she's showing signs that it's shrunk, and maybe they can continue it. It does say a maximum of 2 years, so I don't know, because that's how long they've given her, or whether they will continue that. I mean, if anyone else has been in this situation and has had it, let me know in the comments what your experience has been like. They have discussed that maybe after all this treatment is finished, that maybe they can give her radiotherapy, which is another treatment altogether. But obviously it depends what happens during the initial treatments. So that is where we're at the moment, as far as treatment goes. We're all trying to remain as upbeat as possible. We're trying to be as normal as possible, because I believe that will help my wife in a positive way. If she can see everyone else living their life somewhat normal, I won't say normal, but somewhat normal, then that's going to have a positive effect, I hope, on my wife and how she handles the treatments, etc. I'm hoping to get back out in the workshop and maybe do a couple of small things, maybe make a video on my main channel, but we'll see how that goes. I've not really been in the mindset to do that at the moment. It's a bit easier to come out here and talk to a camera, because however long I spend talking to the camera, that's as long as it takes, and then I can just upload the video. Hence why I said I'd probably repeat myself, yak on a bit, and bore you to death in the meantime. But it's just an outlet for me to kind of let people know that are interested in what's happening, treatments that she's having, and how we're all kind of dealing with it. So yeah, I think I've covered everything I need to cover in this video. So I will continue to post if people are interested. Let me know in the comments if you find these videos of any use or remotely interesting. If not, then I won't bother. But I know a few of you were interested. So that's going to do it for this video. If you have sat through this and watched it, then thank you for that. I appreciate you listening to me drone on. So until the next video, stay safe, look after those that are nearest and dearest to you, appreciate life, appreciate the things that are really important in life, which is the people around you. So until the next video, stay safe, and you'll see me in the next one, guys. Cheers for watching.